I'm going to guide us through an EFT tapping sequence that you can use if you're studying dental local anesthesia and are afraid of giving injections. If you haven't heard of EFT tapping before, then I'd recommend that you watch my other video that addresses fear of needles. In that video, I give a more detailed explanation of what EFT tapping is and how it uses acupressure points to desensitize things that trigger a fight, flight, or freeze response. I also give a more thorough explanation of where the tapping points are so that it's easier for you to find them if you're trying to work on your own. For today's video, I'm going to leave that all out because I've already covered it in that other video. But what I would like you to know is that I'm going to be listing off a whole bunch of stressors. So it's really important to be tapping while you're hearing those stressors listed. Otherwise, you're just getting stressed out for no reason. What I'd like you to do first is just imagine yourself giving an injection and then tune into your body as you imagine that. So you might feel a little bit of tightness in your throat, maybe some tension in your shoulders. Everybody's a little bit different in how they respond, but just see what's there for you. And then I'd like you to also assign a score from 0 to 10 to each sensation that you feel. So 0 is going to be you're not feeling it at all, and 10 is going to be it's about as bad as you can imagine. So now that you've tuned into that scenario and what you feel during it, you can just copy what I'm doing as far as the tapping goes and then repeat the phrases that I'm using to remind us of stressors. You can also just think about them if you don't want to repeat them out loud. So we'll start tapping on the side of the hand. Even though I'm afraid of giving injections, I'm open to loving and accepting myself. Even though I'm afraid of giving dental local anesthesia, I'm open to loving and accepting myself. Even though I'm pretty afraid of giving injections, I'm open to loving and accepting myself. All right, and tap on the top of the head. I'm afraid of giving injections. Tap on the eyebrow. I'm afraid of giving injections. Tap on the side of the eye. I'm afraid of giving local anesthesia. Tap under the eye. I'm afraid of injections. Tap under the nose. I'm afraid of giving these injections. Tap under the lips. I'm afraid of giving dental local anesthesia. Tap on the collarbone. I'm afraid I might mess up. Tap under the arm. I'm afraid of giving anesthesia because I might mess up. Tap on the top of the head. I'm afraid I might mess up. Tap on the eyebrow. I don't know that I feel adequately prepared and competent to give these injections. Tap on the side of the eye. I just don't feel adequately prepared and competent. Tap under the eye. And I'm afraid I might mess up. Tap under the nose. I don't feel fully like I'm in control of the situation. Tap under the lips. And I don't feel like I'm prepared and competent. Tap on the collarbone. And I'm worried I might mess up. Tap under the arm. I'm worried I might mess up. Tap on the top of the head. Oh, I don't know that I feel fully prepared and competent. Tap on the eyebrow. I'm afraid that I don't feel fully prepared and competent. Tap on the side of the eye and in control of the situation. Tap under the eye. And I'm worried I might mess up. Tap under the nose. I'm worried I might mess up. Tap under the lips. I don't know that I feel fully prepared and competent. Tap on the collarbone. I don't know if I know my anatomy well enough. Tap under the arm. I'm not sure that I know things like my anatomy and, what to do in a medical emergency and that kind of thing well enough. Tap on the top of the head. I don't know if I know all that material well enough. Tap on the eyebrow. It was so much to learn. Tap on the side of the eye. And I don't know that I know it well enough. Tap under the eye. I don't know that I know what to do in case of a medical emergency or know all of my anatomy well enough. Tap under the nose. And I don't know that I feel fully prepared and competent. Tap under the lips. I'm worried that I might mess up. Tap on the collarbone. I'm worried I don't know my anatomy well enough. Tap under the arm. I'm worried that I don't know my anatomy well enough. Tap on the top of the head. I'm afraid that maybe I don't know my anatomy well enough. Tap on the eyebrow. And even if I did know it perfectly, it's not like I can see the nerves in the mouth when I look in. Tap on the side of the eye. I can't really see it anyways. Tap under the eye. So I'm worried I don't know my anatomy well enough. Tap under the nose. And even if I did know it perfectly, I don't see it all when I look in the mouth. Tap under the lips. Yeah, I'm worried that I don't know my medical emergency stuff and my anatomy well enough. Tap on the collarbone. And even if I did know it all perfectly, when I look in the mouth, I don't see all the nerves and stuff that I learned. Tap under the arm. I'm worried that I don't know it well enough. Tap on the top of the head. And I don't see what I'm looking for in the mouth anyways. Tap on the eyebrow. And it's just too hard. Tap on the side of the eye. It's just way too hard. Tap under the eye. It's just way too hard. Tap under the nose. I feel so awkward holding the syringe. Tap under the lips. And it's just way too hard. Tap on the collarbone. I feel so awkward when I'm holding the syringe. Tap under the arm. And like I'm not in control at all. Tap on the top of the head. I feel awkward when I'm holding the syringe. Tap on the eyebrow. It's not very smooth. Tap on the side of the eye, and I don't feel in control at all. Tap under the eye. I don't really feel in control at all when I'm holding the syringe. Tap under the nose. I don't feel like I'm in control. Tap under the lips. And I feel like I'm just so awkward and not very smooth. Tap on the collarbone, and really shaky. Tap under the arm. I feel like I'm really shaky when I hold the syringe. Tap on the top of the head. I don't feel very smooth and in control with the syringe. Tap on the eyebrow. It's just too hard. Tap on the side of the eye. I feel so awkward holding the syringe. Tap under the eye. I don't feel like I'm in control and smooth. Tap under the nose. I feel like I'm pretty shaky with the syringe. Tap under the lips. I'm shaky with the syringe and I'm worried that I might poke myself or my patient in somewhere that I don't mean to. Tap on the collarbone. I feel like I'm shaky with the syringe and I'm going to poke something I don't want to. Tap under the arm. I don't feel very smooth and confident with the syringe. Tap on the top of the head. I feel like I'm shaky and I might poke something I don't want to. Tap on the eyebrow. I feel like I'm really bad at using the syringe. Tap on the side of the eye. I'm worried that I'm going to poke something I don't want to. Tap under the eye. I don't feel very smooth with the syringe at all. Tap under the nose. I feel like I'm just shaky and I'm going to end up poking something I don't want to. Tap under the lips. And then on top of that, there's going to be someone watching me. Tap on the collarbone. Someone's going to be watching me and evaluating me and probably judging me. Tap under the arm. While I feel like I'm not competent and not prepared and really awkward. Tap on the top of the head. I'm afraid because someone's going to be watching me. Tap on the eyebrow and judging me. Tap on the side of the eye. And I'm going to feel all awkward and like I don't know what I'm doing. Tap under the eye. And I'm going to be embarrassed and ashamed. Tap under the nose. Someone's going to be watching me do all this, and I'm not going to know what I'm doing, and I'm going to feel awkward. Tap under the lips, and I'm going to feel embarrassed and ashamed while someone's watching me do that. Tap on the collarbone. I'll feel embarrassed and ashamed. Tap under the arm. Someone's going to be watching me. Tap on the top of the head. Someone will be watching me, evaluating me, judging me. Tap on the eyebrow. They might even tell me what I'm doing wrong, and then I'll feel bad about myself. Tap on the side of the eye. This is just going from bad to worse, right? Tap under the eye. Someone's going to be watching me, telling me how I'm messing up. Tap under the nose, and I'm going to feel really bad about myself. Tap under the lips. I might feel ashamed and embarrassed and like I'm not very good. Tap on the collarbone. I might end up feeling ashamed and embarrassed and like I'm not really very good. Tap under the arm. I'm afraid because someone's going to be watching me do all of this stuff. Tap on the top of the head. Someone's going to be watching me and they're going to be judging me and evaluating me. Tap on the eyebrow, telling me how I'm messing up. Tap on the side of the eye. And I'm going to be ashamed and embarrassed. Tap under the eye and feel like I'm no good. Tap under the nose. I'm going to feel like I'm not very good. Tap under the lips. They're going to tell me what I did wrong and what I have to do different. Tap on the collarbone. And I'm going to feel not very good about myself. Tap under the arm. Someone's going to be watching me and I'm going to feel ashamed and embarrassed when I'm not very prepared and feel all awkward. Tap on the top of the head. Someone's going to be watching me and I've got a little bit of like performance anxiety about that. Tap on the eyebrow. Got some performance anxiety that someone's going to be watching me. Tap on the side of the eye. Someone's going to be watching me, judging me, evaluating me. Tap under the eye. And I'm going to be all awkward and nervous. Tap under the nose. And I'm not going to feel prepared and confident and competent. Tap under the lips. And I'm going to feel ashamed and embarrassed. Tap on the collarbone. I'm going to feel ashamed and embarrassed and like I'm not very good. Tap under the arm. I'm going to feel ashamed and embarrassed and like I'm not very good at this. Tap on the top of the head. And I'm also worried about hurting someone too. Tap on the eyebrow. I'm worried I'm going to hurt my patient. Tap on the side of the eye. I'm afraid of hurting someone. Tap under the eye. I'm afraid I'm going to hurt my patient. Tap under the nose. Because I know some of the tissues that I'm going to be going through. Tap under the lips. And I'm afraid I'm going to hurt the person. Tap on the collarbone. I'm afraid I'm going to damage some tissues and hurt the person. Tap under the arm. I mean, I might mess up and cause some complications because of that. Tap on the top of the head. But even if I don't mess up and do everything perfectly, I still might hurt the person. Tap on the eyebrow. I'm afraid of hurting the person. Tap on the side of the eye. I'm afraid of hurting someone. Tap under the eye. I'm really afraid I'm going to hurt someone. Tap under the nose. I know all these tissues that I have to go through. Tap under the lips. And I know that the needle going through them isn't going to be very good. Tap on the collarbone. I know that I'm going to be going through some tissues with the needle. Tap under the arm. And I'm afraid of hurting the person when I do. Tap on the top of the head. I'm afraid I'm going to hurt the person when I go through all those tissues. Tap on the eyebrow. I'm afraid of hurting someone. Tap on the side of the eye. I'm afraid of hurting someone when I put the needle through those tissues. Tap under the eye. I'm afraid of hurting someone when I put the needle through the tissues. Tap under the nose. I'm afraid I'm going to hurt someone. Tap under the lips. I'm afraid I'm going to hurt someone. Tap on the collarbone. I'm afraid I'm going to mess up and hurt someone and cause like a complication that I shouldn't be. Tap under the arm. And I'm also kind of afraid that even if I do everything perfect, I still might cause some complications and some pain maybe. Tap on the top of the head. I'm really afraid that even if I do everything right, I could still cause some pain and some harm. Tap on the eyebrow. I'm afraid that I might mess up and cause some really bad complications. Tap on the side of the eye. But I'm afraid that even if I do everything right, I can still cause some complications. Tap under the eye. I'm afraid of hurting someone. Tap under the nose. I'm really afraid of hurting someone. Tap under the lips. I'm afraid because I'm going to put the needle through a bunch of tissues and I might hurt someone while I do it. Tap on the collarbone. I'm really afraid I'm going to hurt someone. Tap under the arm. I'm afraid I'm going to hurt someone. Tap on the top of the head. There's so many complications I might cause. Tap on the eyebrow. Even if I do everything right, I might cause some complications. Tap on the side of the eye. And there's so many complications I could cause. Tap under the eye. And if I mess up, I might cause even worse complications. Tap under the nose. If I mess up, I might cause even worse complications. Tap under the lips. And even if I do everything perfect, I might still cause some complications. Tap on the collarbone. I might mess up and cause some complications. Tap under the arm. I might screw up and I might cause some complications. Tap on the top of the head. I'm really afraid of screwing up and causing some complications. Tap on the eyebrow. I'm afraid of hurting someone. Tap on the side of the eye. And even if I do everything perfectly, I still might hurt someone. Tap under the eye. Even if I do everything right, I still might cause some complications. Tap under the nose. I'm afraid I might mess up and cause some complications. Tap under the lips. And even if I do everything perfect, I'm afraid I might still cause some complications. Tap on the collarbone. I'm really afraid that I might cause some complications. Tap under the arm. I'm afraid I might hurt someone. Tap on the top of the head. And even if I don't, I'm afraid that it just might not work. Tap on the eyebrow. I'm afraid it might not work. Tap on the side of the eye. I'm really afraid it might not work. Tap under the eye. I mean, there's a certain percentage that fail anyways. Tap under the nose. What if there's some anatomic variation that I wasn't able to detect with what I had? Tap under the lips. Or the patient could just be an under-responder where the anesthesia doesn't affect them enough. Tap on the collarbone. So what if I go through all that and it doesn't even work? Tap under the arm. What if it doesn't even work? Tap on the top of the head. What if there's like a random weird anatomic variation? Tap on the eyebrow. Or they're an under-responder. Tap on the side of the eye. And for some reason it just doesn't work. Tap under the eye. What if I do everything right and it still just doesn't work? Tap under the nose. What if it doesn't work and after all that I have to do it again? Tap under the lips. What if I have to do it all again? Tap on the collarbone. Oh, I'm afraid it won't work. Tap under the arm. I'm really afraid it won't work. Tap on the top of the head. After all that, I'm afraid it might not work even. Tap on the eyebrow. Because sometimes it doesn't work. Tap on the side of the eye, and I'm afraid it might not work. Tap under the eye. I'm afraid it might not work. Tap under the nose. And then I have to do something else or do it all again. Tap under the lips. I'm afraid that I could even do everything right and it still might not work. Tap on the collarbone. I'm afraid I might do everything right and it still might not work. Tap under the arm. I'm really afraid that it just might not work. And then I've gone through all that for nothing. Tap on the top of the head, and it might not even work. Tap on the eyebrow. There's a lot of reasons why I'm really afraid to give these injections. Tap on the side of the eye. There's so many reasons why I'm afraid to give local anesthesia. Tap under the eye. I'd like to be open to some other possibilities, though. Tap under the nose. Like, maybe I'm just learning, and it's kind of normal to not feel fully competent and confident and prepared. Tap under the lips, and maybe whoever's watching me will be able to help me out and give me some useful tips. Tap on the collarbone. Maybe there's even some things I can do so that I will feel more confident and competent and prepared. Tap under the arm. Maybe there's even some things I can do so I'll feel a little more in control of the situation. Tap on the top of the head. Okay, those sound good in theory, but I don't know if that's all possible. Tap on the eyebrow. I'd like to be open to some possibilities like that. Tap on the side of the eye, or maybe some even better possibilities. Tap under the eye, but I don't know if I can. Tap under the nose. I mean, I pretty much have to be really afraid, right? Tap under the lips. Or maybe I don't have to be so afraid. Tap on the collarbone. Maybe there's some other possibilities. Tap under the arm. I'd like to be open to those. Tap on the top of the head, but I don't know if I can. Tap on the eyebrow. It doesn't fully seem reasonable. Tap on the side of the eye. Or maybe it is reasonable. Tap under the eye. No, it's probably not, and not possible. Tap under the nose. Or maybe it is possible. Tap under the lips. No, it's not. I should probably be really afraid. Tap on the collarbone. Or maybe I don't have to be so afraid. Tap under the arm. And whether I'm open to other possibilities or not, either way I'd like to be okay and just accept myself as I am. All right, let's take a break. Take a nice deep breath. Now I'd like you to just picture yourself giving an injection again and tune into what's going on in your body now. Is it the same sensations that you're feeling as you did before we started tapping, or are they different? And if they are the same, would you give it the same rating on the 0 to 10 scale, or would it be higher or lower? I bet you've noticed that some things have shifted and it feels a little bit different. Chances are that the intensity has gone down actually, and it feels a little more neutral or closer to neutral when you think about giving an injection. You might also notice that it might even be a little bit higher than it was before we did some tapping. Sometimes, if we're not quite fully in touch with the emotions we might be feeling about a scenario, then once we do some tapping, we get a little more in touch with them, especially when I've been mentioning some stressors that can go hand in hand with that scenario. So if you're a little more in touch with those emotions now, then I recommend to go through the video another time and tap along now that you're more in touch with those emotions. It'll help to desensitize a little more effectively when you're more in touch with those. You might have also noticed some other aspects coming up as we were going through those stressors. For example, maybe when I was talking about the complications, you were actually noticing like you're afraid of being blamed for those complications occurring. So what I'd like you to do is if you noticed any of those coming up, you can note them down and then tap through the video again to follow along with the points and substitute those into the wording. So let's say it was blame, you can put that in as I was talking about the complications, like I'm afraid of being blamed for the complications. And then as you continue to experience the stimulus of those stressors while you're tapping on the acupressure points, it can really help to desensitize to them so you have less of a fight, flight, or freeze response. And then when you get in an actual scenario of giving an injection, you've already desensitized yourself a bit to that. And it's usually pretty quick with tapping as well compared to like a real life scenario. So we're basically taking the desensitizing that's going to go on as you give more and more injections and kind of giving it a little bit of a jump start by starting it before we even do an injection. And then boosting it because we're moving so much of that energy through the body and helping to calm the fight, flight, or freeze response in advance. So you're kind of getting a little bit more effective desensitization with EFT tapping than you would just by doing the injections.